Hi, I'm Brad Dexter. I'm a physical therapist at QLI in Omaha, Nebraska. Today, we're going to talk a little bit about respiratory health. I have Adam here to help me demonstrate some of the coughing techniques that we're going to look at. It's February, it's the middle of winter, it's cold outside. It's also kind of tail end of cold season in a lot of ways too. And one of the things that we see a lot during cold season is obviously coughs, more mucus production from the lungs. And we have to be able to make sure that we're teaching the people that we're working with to adequately be able to clear their lungs and to take care of themselves that way. And if they can't do it on their own, what are some ways that they might be able to direct someone else to be able to do that? So just real briefly, I want to get into some muscles of breathing and some muscles that help with getting rid of breath, right? Inspiration and expiration. So when we take a deep breath in, some of our big movers are our diaphragm, pulling air in, as well as our rib cage expanding, some of the intercostals in between each one of the ribs. And then if we need to cough or if we need to forcefully exhale and get air out of our lungs, it is going to take muscles of the abdomen to help bear down, as well as muscles in between each one of those ribs to kind of forcefully push that air out. In Adam's case, Adam has an injury up in his cervical region. It's higher, it's a C5 level injury. And so it's difficult for him to really produce a strong cough to clear his airways well. Adam, would you mind demonstrating a cough for us? So that's Adam's cough, just produced on his own. One part of respiratory health would be trying to retrain some of the muscles of inspiration and exhalation. Adam uses a breather on a regular basis. It's basically resisted inhalation and resisted exhalation as well. We can go either ways with that device. But in order to help Adam really clear his airways well, he needs a second person to assist him. So I'm going to demonstrate two techniques that I would use with Adam. One of them is going to be placing my hands on his lower rib cage and pressing down and in to kind of assist with pushing that air out. The other one is going to be scooping some of his abdominal contents and pushing them up into the diaphragm to mimic what would normally happen if the abdominal muscles were able to kind of clench down to help force air out. So I want you guys to just pay attention to the difference in his cough, and we'll ask Adam after we do these if they feel any different. So Adam, will go on your rib cage first. Okay. A big part of this for the person that's assisting is timing. So I'm going to let him lead, and I'm just going to wait for him to start to bear down, and I'm going to help assist with that cough. That's good. How did that feel?
That's better.
It's very much louder. You can tell that there's a lot more force production. We'll do the same thing using the assisted technique down for the diaphragm. Very good.
Yeah, very good.
You know, in this case, I would say that maybe it's a little more comfortable on the rib cage for Adam, and we might get better force production just audibly listening to him. You also notice I stood off to the side when I did this. If we do have any secretions that are going to come up, I don't want to be in front of Adam because those are coming my direction. I may even ask him to turn his head slightly if we have more mucus production. Okay, that's all we have for you today. Again, thank you for watching. If you have any questions or comments, please comment below and subscribe to our channel, QLI.